The health care reform bill is on its way to President Barack Obama's desk. The House approved the measure last night. The bill will obviously create a lot of changes in the medical community, and Allison Struve joins us in the studio with another view on the reform. Good morning, Allison.
Good morning, Rachel. A lot of people in the medical community voicing opinions this morning reacting to the passage of the Senate bill through the House. We actually have Jeff Mason in here this morning in the studio. He's the CEO of BayCare Clinic in Green Bay and the president of the board for Aurora BayCare Medical Center. Good morning.
Good morning.
We've heard that 32 million people who are uninsured, extended coverage is going to be offered to them now. How big of a problem is people without insurance coming into the hospital or the clinic in this area?
In this area, it's not been too bad. Our self-pay category of payers is roughly about 2%, so it's not been a large percentage of our patient population. We expect that to grow, but under this bill, then it actually may shrink. Our biggest challenge is that we've seen Medicaid grow by almost twice what that was in previous years over the last 12 months. Medical assistance, Medicaid, pays us roughly 16 cents on the dollar. Medicare now pays us 17 cents on the dollar. So we are not collecting near what it costs us to treat those patients. Okay. So our only option is to shift those costs to commercial payers, to business, and with all of the tax burden, additional burden, the insurance reform and the requirements that will be placed on employers now, we're very concerned that this is actually a recipe for disaster.
Are you expecting the workflow to change? Are you expecting maybe fewer people to come into the emergency department who have been waiting for a long time? Any changes with doctors, nurses?
There may be some impact on the emergency departments, and we may see some shift when people have insurance to physician offices. But the size and complexity of this bill lends us towards unintended consequences, and that's my big concern. For example, the physician workforce. We have tremendous problems recruiting physicians into Green Bay as it is today. And if we put them in a situation where we're doubling the amount of medical assistance and Medicare patients they see, and the collections drop off, and we have great additional tax burden on them, we have an aging physician workforce, and how rapidly will they decide to just retire? And so it could make patient access that much worse, and I have grave concerns about that.
Those concerns, do you think they're common among leaders in the medical community across the country?
Oh, I believe so. I think the physician shortage is a major issue on the forefront of most healthcare leadership. Nursing challenges. We have the baby boom generation about to come into the highest utilization years. Patient access is probably one of our greatest challenges ahead.
All right. Thank you so much for coming in.
You bet. Thank you.
So a lot of changes on the way, no matter what your feelings on the health care bill, and Rachel will send it back to you.
Okay, thanks.